Hi, this is Dr. Scott Hoar, and this is Treatment Tuesday, and this week our patient is Rose. Rose is an attorney from West Palm Beach. So Rose, thank you for being here.
Thank you for having me. So basically I'm dealing with upper back tension and neck stiffness and lower back pain, I think from working and sitting at the computer all day. And
Okay, so we went over Rose's medical history and we did an initial screening assessment. I'm gonna dive in right now and do a little bit more so we can see exactly what she needs today to help with her neck, low back, and all that things we discussed. Yeah, in health and wellness world, sitting is the new smoking is a popular tagline, because you're right. It's very difficult to stay healthy and balanced with your body when you sit so much. And of course, so many of our modern jobs, we're just sitting and plugging away at the laptop the whole time. Especially during this COVID-19 stuff, I'm sure you're staying in and doing a lot more screen time, a lot more sitting, a lot more laptop time. Good. All right, so I'd like to do an adjustment right in there to get you moving. You comfortable with that?
Yeah, that would be great.
Yeah, let that drop.
Oh.
Very good.
That's great.
And already it's a little bit easier movement. Check on this side, and yeah, it's going to be right there. Can you feel that restriction?
Yeah, it's definitely restricted.
Okay. Yeah, that's going to go nicely. Drop it.
Oh.
Very good. And already a lot of that tension is coming down.
Yeah, a lot of the tension is gone. I feel like there's more mobility now.
I'm back to releasing some muscles here. Cool. All right, I'm going to do some muscle tests, and that's going to tell me what I need to be treating on you with the rest. Make a fist right now. I'm going to push your elbow down into the table. Just resist that pressure. What you don't do during a muscle test is if I push here, don't try to like win. Hold it right there, pushing down, don't let me. Again. Come on, you, get strong. Not so good. Okay. Let's start over here. So that muscle that just tested weak was called coracobrachialis. And a lot of the innervation for that muscle comes out of your neck right here. So I want to see if there's a little bit of right there. And notice no pop, no crack. But make a fist, pushing down, don't let me, go. Made no difference whatsoever. So now I'm going to go into the AC joint, the acromion and clavicle come together, and that's where that muscle attaches. So I'll do a little adjustment there. Good. Make a fist, pushing down, don't let me, go.
I feel like I got stronger. Yeah. That's amazing.
Yeah, that's the whole point. Your thumb and your pinky, put them together like this. Okay. I'm going to pull them apart. Don't let me, go. Perfect. Your elbow, I'm going to pull like that.
Okay.
So resist me right there. Ready, go. And again, now that you know what I'm doing, not very good. Okay, so we're going to do an adjustment to your rib cage underneath your shoulder girdle and shoulder blade. Okay. You're going to put your left palm on your ear, and I'm going to put my thumb in your armpit and wrap my hand around your shoulder blade. Right in here. What I want you to do is relax your elbow, and I'm going to give you an adjustment down like that. Deep breath, breathe on out. Very good. You all right? Okay, I'm going to pull your elbow out like that. Don't let me. Ready? Go. Good. A lot stronger, yeah? Okay. I'm going to stabilize your opposite hip. Don't let me do that. Kind of weak. Yeah. Pushing diagonally that way. Don't let me go. Pretty weak. So what I'm going to do is an adjustment to where your clavicle meets your sternum. This one doesn't feel great.
Okay.
Good. Hold it right there. Pushing directly out that way. Don't let me. Ready, go. No better. Activate a little bit. Hold it right there. Pushing this way. Don't let me. Ready, go. No, not at all. Okay. Any irritation when we did that?
Yeah, on the elbow.
Oh, okay.
Right there.
So I'm going to check something else then. Straighten your hand. I'm going to pull towards me. Don't let me do that. Go. Come on, you. No strength.
None.
Pushing towards you. Don't let me. Ready, go. No, other way around. You push.
Wait, resist that way.
Resist that way. Ready, go. Did that elbow hurt during that?
Minor discomfort, yeah.
Ready? Go. Okay. And now I'm going to push again. Same sort of thing. Don't let me. Ready? Go. Good. That seemed a little strong. One more time. Push and don't let me. And that was weak, wasn't it? So again, just feeling for where is your elbow restricted. All right. So. All right. I'm going to push from right here, that same muscle test. Don't let me. Ready? Go. A little stronger, wasn't it? Did you have that same irritation in the elbow? Or is it less?
It's reduced, less.
Okay. Go. Good. Again. Yeah, that bicep's a little weak. Man, you got all sorts of stuff going on here, don't you?
I do.
So the bicep was weak. The bicipital tendon goes right up here in the shoulder, and there's this little groove for it. It's very easy for the tendon to pop out of that groove. So I'm going to make sure it's where it's supposed to be. This is probably pretty tender, yeah?
Definitely tender.
Uh-huh. Straighten your hand. Pull in towards me. Don't let me. Ready? Go. And boom, that's stronger, wasn't it? Good. Let's go test your pecs. Pushing out that way. Don't let me. Ready? Go. Again. No, that's not doing anything. Did the elbow hurt still?
Less.
So I'm now releasing your pec and pec minor. This is a muscle treatment. Get these guys to fire.
Yeah, there's definitely a lot of tension.
Yeah?
In the pec.
So what we do to release the muscle is you put the pec in a shortened position, which is this. I grab the muscle and put a tension through my thumb and hand, and then we lengthen it. And I'm sure you can feel that stretch.
It's definitely intense.
Yeah. Don't let me do that. Go. I think that might be it. So we're going to get that from another position in a second. Make fist. Pushing down. Don't let me do that. Ready? Go. Again. Not so strong. So we'll adjust your AC joint over here. Great. Fist. Pushing down. Don't let me. Much better, yeah? Thumb, pinky. Pulling apart. Don't let me. Beautiful. Your elbow, I'm pulling out here towards me. Don't let me do that. Go. And again. Yeah, we're going to have to do that same armpit adjustment. Put your right palm on your ear. All right, deep breath. Breathe that out. Very good. Elbow back over here. Pulling out. Don't let me. Ready, go. Much better. Let's check out these pecs. Hold it right here. Pushing that way. Don't let me. That way, don't let me. Whole different level of strength here, huh?
Yeah.
Okay. That's stiff, huh?
Yeah.
Does that cause low back discomfort?
Not what you just did.
Okay. Okay. So I'll do a little release here. So this just mobilizes your hip. You okay?
Yep.
How's it feel?
There's some pain in the knee.
In the knee?
Yeah, on the left side.
And was there pain in the knee before I did that?
On occasion, yeah.
Okay, okay. I'm going to do another little manipulation. There you go. Right here it is, a little thrust on the hip, okay? Good. All right. All right, good. So that internal rotation has cleaned up a little bit. Does that still hurt the knee?
No.
Cool. Good. All right, muscle test, pushing down like that. Don't let me do that. I'm going to stabilize your other arm. Ready, go. Again. Not so good. Other side. Pushing down, don't let me. A lot stronger on that side, huh? All right, so your hip flexor muscle tested weak, and majority of the innervation for that comes out of your L2 segment, which is right here. So we're going to manipulate that segment. Breathe out for me. Very good. I'm going to push down. Don't let me go. A lot stronger, yeah?
Yeah.
Good. All right. I'm going to push down and out. Don't let me do that. Go. Again, a nice little pop. Down and out. Ready, go. Pretty strong. Over here, down and out. Don't let me. Ready, go. Very good. I'm going to push down and in. Don't let me do that. Ready, go. Pretty good. Down and in. Don't let me. Ready, go. Not good. Head up. Very good. Hold it right there. Pushing down and in. Don't let me. Ready, go. Much better, yes? Mm-hmm. Yes. Definitely got a stiff spot right there, huh? Okay. So what I'm going to do is bring your head over there. I'll give you a little thrust down there like that, okay? That didn't like it. You okay?
Yep.
All right. Deep breath for me. Breathe that out.
Whoa.
You okay?
Yeah.
Deep breath. Breathe out. Ooh, that didn't like it. We're going to hit that from a different direction in a little bit. You okay?
Yeah.
We're going to do a muscle test. I want you to raise your knee up. Hold it right there. I'm going to push your knee into the table. Don't let me go. Very good. Up into the table. Pushing down. Don't let me. All right. No, that's fine. Here's that same muscle test from a different direction. I'm going to push your elbow forward. Don't let me do that. Go. Again. Yeah, that's a little bit weak. Let's try that on this side. You can relax this guy. Pushing your elbow forward. Don't let me. And that's strong, wasn't it? Mm-hmm. All right, so we're going to adjust you on this side. All right, so I'm going to do a little thrust right there like that, okay? Good. Right here. Pushing your elbow forward. Don't let me. Much stronger, yes?
Yeah.
Good. I'm going to grab you. We're going to kind of roll back together like that, and then I'll do the adjustment, okay? Good. That's great. Okay. So hold that and do that nice clean rotation to the left with your head. Good. Without dropping the kettlebell, which you're doing perfectly. That first exercise where we had you hold the kettlebell in your left hand and turn your head to the left. What was that like?
It was initially difficult, but I feel like it was strengthening that left pec.
What's most dysfunctional about your neck and shoulder movement are those movements that we addressed. So if you just did the one, you'd be fine. If you are one of those types, the type A that wants to do both, great, no problem.
Okay.
Now that second exercise where we were doing the good mornings, where you were actually, the point of that was the band was engaging your stabilizing forces, and then you were shifting your hips back in what we call a hip hinge movement. So you were learning to have movement through your hips while keeping your spine neutral and protected. What was that like for you?
Felt like it was doing everything that you just mentioned, keeping my hips protected.
Yeah, so it felt good.
It felt good.
All right. Okay, so that's our treatment today. Rose, how did that go for you?
It went very well. I feel like I have a better range of mobility in my neck, and there's definitely less tension and stiffness in my spine and low back. I feel like everything's flowing better.
What'd you learn today?
Overall, I learned that chiropractic adjustment definitely helps for reducing the tension and pain and stiffness that I was experiencing from working at home, working remotely on the computer, and that really improved the range of mobility, especially with the neck as well.
We saw that you were able to do your camel pose, and what did that feel like for you when you're doing the camel pose?
It felt a lot better than when I initially came in. I felt like I had less tension in my low back and greater hip mobility.
Very good. Any other questions, concerns, comments about anything?
Yeah, one question related to that. So once the COVID lockdown ends and I can return to Pilates classes, and a lot of those exercises involve like a hip lift where I experience some popping, should I refrain from doing that or modify?
Yeah, and the great thing about Pilates, and I love Pilates by the way, is instructors are very good about working with you on altering each particular movement and keeping it in the healthy range of motion. Because I'm sure there's lots of those Pilates instructors that are doing those particular movements and they're doing great, but your hips pop during it. So whether you're able to find another strategy that engages your core to where you do a leg lift, like maybe just doing one leg at a time, or different sorts of things, if you're able to stop the popping, then you can do it and be healthy. If you're unable to stop the popping, it's not the right movement for you.
So could I proceed with a range of motion before I experience the popping and it would be okay?
That'd be a great thing to do.
Okay.
Yeah, keep it in the healthy range of motion where your body doesn't lose all control.
Okay, got it. Great.
Good. Any other questions?
No.
Okay. Well, Rose, thank you so much for coming here today. You were a lot of fun to treat. Thank you so much for watching. Don't forget to subscribe, hit the like button, and leave a comment below. See you next Treatment Tuesday.